Hey there, ever looked in the mirror and noticed some faint white spots on your teeth and kind of wondered what they are? Well, there's a good chance you're seeing something called dental fluorosis. In this explainer, we're going to break down exactly what that means, how you can spot it, and all the modern ways we can treat it.
So yeah, if you've seen those little faint white lines or maybe some chalky patches on your teeth, you are definitely not alone. It's actually the first sign of a super common condition, and over the next few minutes, we are going to get to the bottom of it. All right, so let's dive right in with the basics. What in the world is dental fluorosis? Okay, the first and most important thing to know is that dental fluorosis is not a disease. It's simply a cosmetic condition, one that just changes how the tooth enamel looks. It happens when a child takes in a bit too much fluoride while their adult teeth are still forming under the gums. We're talking usually before the age of 8. Now here's the biggest clue, the real telltale sign of fluorosis. It's almost always symmetrical. As you can kind of see here, the changes pop up on both sides of the mouth. So if there's a white spot on a tooth on your left side, you'll probably find a nearly identical one on the very same tooth on the right. For dentists, that's a key giveaway. It's also really important to get that fluorosis isn't, an all or nothing thing. It actually exists on a whole spectrum, from changes so subtle you'd barely even notice them to more significant cosmetic issues. The severity is basically tied to how much extra fluoride was consumed and for how long while those teeth were developing. So let's just walk through each stage, starting with the most common and mildest forms. So in its most subtle form, fluorosis just looks like small, opaque, kind of paper white areas. Sometimes they look like these fine, lacy lines. Dentists actually call this snowflaking. Honestly, these are often so faint that only a dental professional would probably spot them during a regular exam. With mild fluorosis, those white opaque areas are just a bit more extensive and noticeable. They might cover up to about half of the tooth surface. But what's important here is that even with these visible patches, the enamel itself is still perfectly smooth and intact. Now, once we get to the moderate level, the appearance starts to change a little more significantly. Usually all of the tooth surfaces are affected. And this is where staining can begin to appear, often a yellowish or light brown color. This discoloration is typically what makes people start looking for cosmetic solutions. And in the most severe cases, the structure of the enamel itself can become more porous, even a little compromised. This can lead to visible pitting on the surface, little potholes really, and the staining can become more widespread and dark brown. So if you or your child has fluorosis, what can you actually do about it? Well, the great news is there are a ton of excellent options available today to improve the cosmetic look of your teeth. Generally, treatments fall into two main categories, and it all depends on the severity. For those common mild cases, the whole goal is to blend the white spots so they just match the rest of the tooth. For the more moderate to severe cases, the focus really shifts to covering up the discoloration and fixing any of those surface irregularities. For those mild white spots, we've got 3 fantastic, conservative options. Teeth whitening is often the very first step. Why? Because lightening the overall shade of your teeth can make the white spots way less noticeable. Other options include microabrasion, which gently removes a microscopic layer of enamel, and a really cool modern technique called resin infiltration. Resin infiltration, I know, it sounds super complex, but it's a very simple and minimally invasive process. First, a special gel gets the enamel of the white spot ready. Then, a very thin, liquidy resin is applied. This resin just soaks right into that porous area, and by changing how it reflects light, it often makes the spot visually disappear. It's pretty amazing. Now, for cases with staining or pitting, we need to bring out some different tools. Composite bonding uses a tooth-colored filling material to cover the spots or fill in pits. And veneers, well, veneers are these thin, custom-made shells of porcelain that are bonded right to the front of the teeth, creating a brand new, perfectly uniform surface. Of course, the best strategy of all is prevention, right? And this really just comes down to carefully managing fluoride intake for young kids while their permanent teeth are still developing. Okay, parents, this one's for you. The first critical window to monitor is from birth all the way up to age 3. During this time, it's all about the amount of toothpaste you're using. For this age group, the American Dental Association recommends using only a tiny smear of fluoride toothpaste. We're talking no bigger than a single grain of rice. That's it. Then, as your kids get a little older, the recommendation changes just a bit. The next key age bracket to watch is from 3 to 6. Once kids are a bit older and, better at spitting,
The amount of toothpaste can be increased, but to no more than the size of a single green pea. Following these specific amounts is the real secret sauce to getting the awesome cavity-fighting benefits of fluoride, while minimizing the risk of fluorosis.
And it's not just about the amount of toothpaste, right? Supervision is absolutely crucial. Make sure your child spits the toothpaste out instead of swallowing it. It's also a great idea to know the fluoride level in your drinking water, especially if you have a private well. And finally, just remember that fluoride supplements should only be used when they're specifically prescribed by a doctor or a dentist.
Whew, okay. We have covered a lot of ground. So let's do a quick recap of the most important things to remember about dental fluorosis.
So, to sum it all up, number 1, remember that fluorosis is just a cosmetic condition, not a disease that's going to harm your health. Number 2, the vast majority of cases are super mild. For anyone who is bothered by how it looks, there are fantastic, effective treatments available. And finally, prevention is all about watching that fluoride toothpaste for kids under 8.
At the end of the day, just understanding what fluorosis is, that's the crucial first step. Whether you're thinking about options for your own smile or you're focused on prevention for your kids, the absolute best path forward is to have a conversation with your dentist. They can give you personalized advice to help you get a healthy, confident smile you love.